Myself, Dr. Prakash Mhetre from Anantara Concept Homeopathic Medical College. We are dealing with the types of prescription. In last two lectures, we are studying about that. In today's lecture also, we are continuing with the same topic. So let us start with the today's topic, that is types of prescription. Next type of prescription is on the basis of homeopathic remedies. As we know that the certain medicines have affinity to certain organs of the body. For example, some medicines have affinity towards the brain, some have affinity towards the heart, some affinity have towards the lung, and some affinity for liver, gallbladder. Likewise, if these organs are affected, then medicines have affinity to the corresponding diseased organs are given on the basis of common symptom. And this prescription is useful. This type of prescription is mostly useful when there is a lack of symptoms or there is a scarcity of the symptoms. Then next type that is prescribing on the basis of laboratory investigation. In certain conditions in which there is neither causation is absent in that disease, or there is a lack of symptoms or no symptom is found. In such cases, we have to go for the investigation. Under such condition, the prescription is made on the basis of blood investigation. For example, whenever there is a increase of WBC, that is leukocytosis, or sometimes there is a pus in the urine, or increased erythrocytic sedimentation rate. In such cases, we can think about the pyrogen. Or sometimes, in some cases, there is a found of RBCs in the urine. In such cases, we can select the Cantharis remedy. So likewise, on this laboratory investigation, we can choose a correct remedy. Next type is that is prescription on the basis of autotherapy and autohemotherapy. The first point is when there is nothing to prescribe in the case, but the patient is suffering from the chronic disease, then we have to prescribe on the basis of autotherapy. If sometimes there is no homeopathic medicine is found, in such cases what we will do, then we have to take the disease material from the body of the patient, like urine, blood can be taken, and that material is potentized according to the homeopathic principle. That is nothing but the autotherapy or autohemotherapy. Proceed for the next type, that is prescription on the basis of patopathy. In this type, as we know that the most of the drugs in allopathic science that causes the side effect, like anti-diabetic drugs or antihypertensive, anti-epileptic, antipsychotic drugs or sedative, it may causes the side effect. Now the same drug which has caused the side effect, that drug is taken and that is potentized according to the homeopathic principle, and that is administered to the patient who have been harmed by the same drug in the crude form. Okay, this is the patopathic mode of prescription. The next type is prescription on the basis of allergy. As we know that most of the individuals or patients have allergic to the dust, or allergic to some specific food material, allergic to the fruits, or allergic to the pollen grains. These substances which causes the allergy to the patient, such substance is to be taken, that is potentized according to the homeopathic principle, then is administered to the same patient. This is nothing but the prescription on the basis of allergy. The last type of prescription is mostly based on the prescription on the basis of placebo. As we know that what is meant by placebo? Placebo means to please. In order to please the patient, to make him feel that he is taking medicine. In which condition we have to prescribe the placebo? The first condition is the action of the former dose is either continuous. The given medicine is working good, then in such cases there is prescription to be given as a placebo. The next condition is whenever the action of former dose has not taken place, means in that case we have to wait and watch. There is no need to prescribe the different medicine. We have to wait and watch and prescribe the placebo. The third point is if physician has a confidence that his selection of medicine is right. In such cases, there is no need to change the medicine. We have to prescribe the placebo. Next point is there is some improvement takes place, but there is some improvement taking place in the patient, but there is no progression of the disease, no progression of the cure. In that cases also we have to wait and watch and give the placebo to the patient. And last point is in some time there is till some new symptoms develop calling for a change of medicine. Means there is after giving your correct medicine, if the new symptoms is not appearing in the patient, which is called for the next medicine. In such cases we have to give placebo. These are the some indications or conditions we have to prescribe the placebo. So friends, thank you. Our Master Hanuman has said in chronic diseases that do homeopathy and give reward to your conscious mind. This is given in first volume of chronic disease. And thank you.